The third therapy of VOCSN I can use using the same circuit. So the same circuit that I use for ventilation, the same circuit that I use for oxygen, I can now also do cough therapy. Now, cough therapy you may or may not be familiar with, but you and I, when we get sick, we get secretions and we cough. It's a very natural and effective way of clearing those secretions and keeping our airways free and clear of infection. Cough therapy, or mechanical insufflation-exsufflation, is simply a big flow of air in, a quick rapid change flow of air out, mimicking that cough and bringing those secretions up. Instead of doing deep suctioning, it's a more natural and effective way of clearing those secretions. Cough therapy traditionally is a separate device requiring you to disconnect from your life support ventilator, which creates a lot of anxiety, connect to the cough assist, do the cough maneuver, then perhaps do suction, and then hopefully somebody remembers to reconnect you back to the ventilator. That could take anywhere from 15 to 30 minutes. That could require up to 2 different caregivers to help you out and requires multiple different devices and attachments to the patient. In this case, we have touch button cough. One device using that same circuit, and we have uninterrupted ventilation for the VOCSN user. So I'm going to simply hit C. And again, this looks very familiar. 3 simple presets. In this case, I've named it low, medium, and high. I've set it for a big cough or a small cough. I can set all of my settings in the settings just like you saw with ventilation. And in this case, I can literally do cough with the touch of a button. We call it touch button cough. I'm going to go ahead and grab my lung here. This is mimicking my VOCSN user. You can see that currently my patient is breathing. And simply with the touch of a button, without disconnecting the circuit, you're going to see that we go from a V to a C. So I'm going to go ahead and hit start. It's going to find a natural point in the patient's breath. It's then going to do, in this case, I have it set for 3 cough cycles. We're going to do our 3rd cough cycle, and then you'll see that we go right back to a V. Uninterrupted ventilation, no need to disconnect the circuit, cough at the touch of a button. A lot more comfortable for the patient, a lot more convenient for the caregiver. That literally took seconds as opposed to minutes, and I only had to manage 1 device.